Let's start from the first again. So I'm sure a lot of you are under an immense amount of stress. Uh, Exam dates have not been consistent. You got the dates just now. There's a new book which has been released, the 28th edition. You sometimes don't know whether to read from Sabiston, to read from Bailey or Schwartz, what sort of materials to read, whether to use the MCQs, whether to use the videos for learning. So there's a lot of doubt. There is a lot of confusion amongst uh, the entire student population right now. So let's use this session to clear these doubts. We have about 20 to 25 minutes where I'll be covering which topic to cover from which book, how to structure your preparation, and how to make sure you're focused during these over the next few months. So basically, this is going to be the agenda for today. If you have any doubts, you can also put it up in the group. You can also put it up in the chat as well. So I'll be sharing my screen. Let's start. So I'm Vinayak Rengan. I'm the founder of Search Test, and I'm also an MCH resident in pediatric surgery. So where do you read your basics in general surgery from? So the real where you actually need to read it from is Bailey and Love 28th edition. There have been a lot of subtle changes in your Bailey and Love 28th edition, which are essential to note. And for example, if you take the chapter diagnostic imaging, uh, what is the criteria for stopping metformin? Uh, it was about the EGFR was 60 in the previous one. Now it's different. So minor changes are there in the 28th edition. And from an examiner's perspective, they tend to ask these questions. However, for people who have read 27th edition, do not despair because a lot of questions, some questions will be from 27th edition as well. It need not be that everything has to be from 20th edition. So there will be a little bit of confusion because this is a transition year. Next year, it's going to be much clearer that it is all questions are going to be from 28. But if you're starting a preparation afresh, I would say just confine yourself to Billiard or 20 edition. The basics in general surgery chapter is absolutely the entire 12 to 15 chapters are super important. You have to read them word to word. Each and every question can be a line, can be a question. Uh, Try to use the Billion or 20 edition question bank in the Search Test app. It has been updated over the next 1 week. The basics in general surgery part will be updated over the next 1 week completely. Sabiston, should you use it or not? Use it for very select chapters. I would say use it for the short chapter alone. Pediatric surgery, the emphasis in the last few years, Neet assist is very high. Bailey and Love 28th edition has split the old one chapter in the 27th edition into four chapters. The content is not much different, but you will have to read it completely in a very thorough manner. The search test videos, however, are much more comprehensive and encompass points from pediatric surgery textbooks from Ashfaq Holcomb, Quran, also from Sabiston and Schwartz. So make sure that you see the search test videos for the this thing. The 20th edition test and discussion also will be covering the topics. We have taken two topics. For the next 10 days, we'll be covering many more topics in pediatric surgery as well. So pediatric surgery is very essential. Don't forget to read pediatric surgery. Along with pediatric surgery, cardiothoracic and vascular surgery, CTVS and vascular surgery, I have not put it up in the slide, but do make sure that you read a Billion Love completely. Cardiac surgery, you can also read from Sabiston. It is a little more comprehensive than usual. It will take a bit of time, but if you have that time, if you have finished everything else, and if you have, say, 2 or 3 days extra in your preparation, read cardiac surgery from Sabiston. Urology, Billion Love 20th edition, know the book, solve the MCQs in the Search Test app, read the book, that's it. You don't need to do anything else, and that should be a priority. Don't use Sabiston or Schwartz just because a couple of extra points are given over there. Plastic surgery, Burial of 20th edition is should be your basics. The search test videos are going to enhance your understanding. In the test and discussion as well, we had Dr. Ashok Reddy take a few classes in plastic surgery, which are super comprehensive and covered all the points essential for your Neet SS level. So do remember, Bailey and Love is your go-to book for plastic surgery. Now, GI surgery is going to be the biggest chunk of your preparation, as we saw in the NES, INSS as well. The general surgery part was essentially GI surgery. So GI surgery is going to be a big chunk of your 150 questions in your NEET SS. And you cannot get a great rank without reading semester 21st edition. Just remember that for sure. You cannot get a good rank. But if you feel that you have read only Bailey and you don't have the time, use the search test videos as an adjunct for your preparation because the search test videos cover all the points from the Sabiston in the videos. So use that as an adjunct for preparation. But if you want to get a top rank, always read Sabiston. You can't be without reading Sabiston. It's non-negotiable. Endocrine surgery. Endocrine surgery is again super important. As you know, breast and thyroid are extremely important topics for your general surgery preparation. From Schwartz, this is one topic where I would recommend that you read Schwartz. Breast and thyroid, you should read from Schwartz. The amount of information given is very useful. It's pretty comprehensive as well. Bailey and 20th edition, breast, thyroid, adrenal, and parathyroid. You will have to read entire endocrine from Bailey, but breast and thyroid you also have to read from Schwartz. Parathyroid and adrenal, a lot of you have been reading Sabiston. I don't think it's essential. Really, and Love 28th edition itself is important. The searches videos are kind of comprehensive because they summarize both Schwartz and Bailey and Love. So they're going to be very essential and crucial for your preparation. So basically, this is we have covered all the topics to be read from Bailey and Love and Schwartz and Sabiston. Uh, how do you maintain focus during these periods? As I mentioned in the class where we spoke about how to increase attention span, the art of practice boredom is very essential. If you're distracted, if you're bored, don't pick up your phone, don't pick up your tab, don't try to read online news, see YouTube. Make sure that you sit still without doing anything. It means that your attention span is increased because you are not looking for instant gratification. That micro satisfaction is what they call. You know, when you're bored, when you use a phone, there is a significant amount of micro satisfaction or instant gratification that happens. Which means that when you're reading something, when you're reading a book, what really happens is that there's a good amount of boredom which happens. It's obviously not as interesting as the Facebook reel or YouTube shorts. Is yeah okay. So obviously you tend to use your phone. You think you're just checking out something. You're checking the surface group or just checking out some updates on the Facebook. We are actually essentially fooling ourselves. What we are doing is we are trying to seek instant gratification, gain that small bit of micro satisfaction for the boredom, which is basically reading. Which means that you have to get used to the concept of boredom. And if you want to optimize your time, if you were have a see, you're good. Many of you are going to be working SRs or assistant professors in a medical college or residents, which means that you go to work say 8 hours or 10 hours a day, which means you have 2 to 3 hours at the end of the day to prepare. In these 2 to 3 hours, how do you maximize the value of your time? Which means that you will have to learn the art of getting bored. This is what I call as the art of practice boredom, which means that you need to just sit and do nothing for about 15 minutes in the morning and 15 minutes in the evening. Don't try to feel guilty that, oh, in this 15 minutes, I could have solved 10 MCQs. No. These 15 minutes is basically sharpening the axe for an intense amount of preparation which you're going to put in some time. You can check out the video on attention span where I've spoken about how to increase your attention span, the techniques to improve focus for your preparation. This is way beyond the scope of this particular discussion, but basically this is the thing. So how do you do your revision? So study is basically reading. Revision should be in the form of MCQs where you actually solve at least 100 MCQs a day. And solving 100 MCQs a day in the stretch is quite difficult, which means the moment you wake up, solve 5 MCQs. You know, when you're waiting for your bus or when you're traveling to work, solve about 10 MCQs. You're in the OT between two cases while your junior is shifting cases, solve 2 to 3 MCQs. And make sure you see 1 hour of videos. The videos can be put in audio mode when you're traveling in your car. Put it on your headphones while you're traveling, or when you're bored when you're going for a walk in the evening. What it does is it reinforces learning on a significant level. Social journey surgery, we have say about 120, 130 hours of videos. You can easily cover that in a few days, in a few weeks' time. So just make sure that you do 1 hour of videos. Sometimes it need not be even a specific video about a topic that you're reading, but it can be some random video you're listening to the audio. It reinforces all the points about. The funda of your preparation is consistency. If you cannot be consistent, you cannot get a good rank in the exam. So just make sure if there will be days when you're not read well. But the fact that you picked up the book and sat down for half an hour makes reading a habit. And that is going to be very crucial to make sure that you kind of you know get get going and are able to so yeah, so basically this is the presentation aspect of it. So right now you might have doubts, when do I structure my preparation, how do I structure my preparation? So you have around we have June, July, August, we have 3 months, more than uh, slightly more than 3 months, 3 months and around 20 days. So I would say if you're reading anything afresh, it should stop within the next 2 months. And if you want to read something new, so some of you put off, see, for example, a lot of people have a problem with pediatric surgery and cardiac surgery. They will revise GI surgery for hours and hours together. You would have read GI surgery in February, March. Now you want to revise GI surgery again, but you want to put off reading um, cardiac surgery. Never do that. If you have to read something afresh, do it today, do it now, do it within the next 1 month or 2 months. You should not be reading anything new 1.5 months before the exam, unless you are super pressed for time and you are a resident of that, anything of that sort. Everything else should be revised during that 45 days time. During that 45 days time, the bulk of your revision should be for GI surgery, basics in general surgery, and endocrine surgery, because these are the core topics in which multiple amount of questions are asked. One topic which you should definitely revise again and again is trauma. Bay love is more than enough. The 20th edition is much more than effective, more than enough for that. So if you can complete your revision within the next 2 months, sorry, your first reading in the next 2 months, and you don't read anything after 2 months, make sure you revise all that you have read over the 45 days before the exam. MCQs are the key to revision. Make sure you solve 100 MCQs a day so that when you look through the conversation, you know that how many MCQs you solved. And the number is very important because that number sets a target, a consistency. Make sure you go through the explanation. So how do you revise the MCQs? So we have around 2000, 2200 MCQs, which means that over the next 1.5 months, you will be able to solve one full revision. During this time, the 100 MCQs are going to take you 2 to 3 hours a day, which means that you will have to uh, read the explanations as well. In the last 45 days, just make sure you don't spend too much time reading the explanation. See if you know the concept, think if you know the concept, and then keep on moving. So basically, this is how you should structure your MCQ reading and your preparation. Before you're about to sleep, it's going to be super difficult for you to solve MCQs or maybe even read something missing. And that is where your video lectures, the search the journals and the video lectures, not the testing discussions. These are super critical for you to revise and to reinforce your concepts. And toppers who have got to the top 50 rank in the exam, they always told me, they used to spend 1 hour in the night just listening to the videos or seeing the videos. Sometimes they have seen the video once or twice, put it at 1.5 speed. So that's very crucial to make sure that your preparation is decent. So that's it, guys. So if you have any doubts, you can ask me right away. Somebody has asked me, will the video be posted in YouTube? Yes, it will be. Uh, is ortho important? Yes, ortho is important for sure. And we have added that in the video lectures as well. We'll be adding that, which is being covered in the testing discussion as well. So that is the amount of ortho which is necessary. Neurosurgery, brilliant love is enough. The surface video lectures are good enough. Hand surgery is being covered in the video lectures. I think I'll make sure it's updated as well. Yeah, the 20th edition based question bank is being updated right now. I promised that it will happen by May 15th, but it's today's early 16th. But over the next 1 week, the basics in general surgery will be done. The new grant test will start by June first week. What's the latest edition? 11th. Yes, in-depth plastic and CTVS questions are coming. Somebody asked for Kahoot test. I really want to do Kahoot. Unfortunately, I don't have the resources right now. But from June 1st, I'm planning to restart the old Kahoot series. Yeah. See, after watching videos, sometimes seeing the book, this point is missed. See, the thing is that at some point of time, in everything in the videos or the book, some point will be missed. Don't stress too much about it. Make sure you read your book. The topics which I told from the books is the same. There'll be some extra points in the videos. Use that for the extra point. The videos might miss a couple of points, but that's okay. As I told earlier, you don't need to read Sebastian for the general surgery part. But Sebastian, shock you is a chapter which you need to read. Yes, plastic surgery we'll cover in more detail with images. In fact, the plastic surgery question bank for INISS is also likely to be released within a month. But yeah, we'll add a lot more images over the next few days. Yeah, yeah, grant tests are good, but it's more important to solve all the MCQs. If you can solve 2 to 3 grant tests before your exam, just to set pace, it's okay, more than enough. You can't predict how many questions from each part, GI, endocrine. You can't predict. Hard copy notes, yes, hard copy notes plan is there. We are trying to make it. In fact, we had made it, but it got outdated because of the new edition. So we have to start remaking it. So that's been a little bit of a challenge. Oh yes, MCQ's image-based model. If you kind of look at the new MCQs, a lot of the questions are already image-based questions. We'll try to make a separate image-based questions as well. Um, Jamin has asked me if you can make the option of solving Bailey in the 20th edition. I'll try to do that for sure. Uh, So this Neet again, I would say pediatric surgery and CTVS. The emphasis is going to be there for sure. Maximum bulk is always going to be from GI surgery and endocrine surgery. That never changes. You can't predict exactly how many questions, but for definitely. Savison PDF tables, I'll try to make it and give it to you within the next 15 days. If you're preparing full time, the strategy doesn't change much. Somebody has texted me on direct message. The strategy doesn't change much. It is just that if you're solving 100 MCQs a day, just push back to 200 MCQs a day, continue reading. The fact is that no human being, not a no human being, most of us cannot read for more than 5 to 6 hours a day. Because that 5 to 6 hours a day is when you can actually focus. So the rest of the time, just make sure that you see videos and MCQs. If you try to push yourself to read for more than 6 hours a day, what happens is that you definitely go out of focus. Yes, Divakar, the INSS new lectures will be updated. We are already shooting. Where to read neurosurgery, Bolu and now is more than enough for Neet SS. If you're quitting a job, make sure 45 days before the exam you are able to quit your job. 3 months is more than enough for the preparation. If you look at some of the previous toppers, they've just studied for the MS exam and gotten uh, gotten rank within 45 days of preparation. So that's amazing. Yes, now third year DNB student practicals are there. It's not easy, but most probably the practicals are going to be about 1.5 months before the uh, exam. So it's a tough challenge. But if you have to focus on your DNB practicals more than your NEET assessment because that is more crucial. If you don't pass your DNB practicals, you will not be able to get into NEET assess. So focus on your practicals. Rest of the time, just make sure you solve 100 MCQs. Don't try to read too many things for uh, NEET assess as of now till your practicals are over. See, when you're studying for your theory, there is not too much of a difference between what you're reading now for your theory and what you're reading for your MCQ bank. So just make sure that you continue your preparation for your exam. It actually covers most of the points which are needed. See, if you're reading for your final exams, also don't try to read from Bailey GI surgery. Read from Savastin, which makes life easier for you when you prepare for NEET SS. Yeah, so when will it be updated? It is already being updated. So by tomorrow or day after, you will see that about 70 new questions are added. By 15th of this, in next 2 weeks, you will see that most of basics in dental surgery is updated. GI surgery will also be updated within the next 3 weeks. Few tips to read GI from Sanderson. The most important tip I would say is don't try to read everything on a stretch. Make sure you have 2 to 3 hours for GI surgery every day, and make sure you take notes. It will take you 2 months to finish GI surgery from Sebastian if you read 2 hours a day. But if you have made sure that you have put the notes, that is more than enough because the notes is something you can revise. I created my own notes when I was reading from Sebastian 20th edition when I was doing my MS, and that is the only thing which I read for NEET SS as well. Pediatric surgery searches videos are more essential than any of the books, but Bailey and Love is something you have to read and then watch the searches videos. You are a first year resident, how to start preparing? I would say start solving MCQs and whenever you're free, but and start reading Brilliant now. get the habit of reading textbooks when you're in your first year. That is more essential at this point of time. And after you read a chapter, solve MCQs whenever you're free. CTVS, you don't need to read all the surgeries in detail. See, the thing is that CTVS is such a broad topic. You can read from Savison, but if you try to read it too much detail, there's a chance that it may not be asked also. Just because in one key test it was asked, don't try to, think that it's going to be a major issue. The best time to read self-made notes is always, if you have self-made notes, that's better than anything. How to revise MCQs, as I told you before, you have to go through at least all toppers, literally about in the top 100 rankers, almost everybody uses search test. And when I spoke to at least 80 of them, I spoke to them. And there was one thing which was very consistent. All of them had solved the MCQs at least twice or thrice. And many of them, at least 50% of them, had seen the videos at least once or twice. So make sure you solve the MCQs twice. I think that is very crucial for you to, get the concept in your mind. Yeah, so Dr. Arun, so if you look at the last week assess, neurosurgery and this thing, the surface videos are pretty comprehensive. And that would be very essential for you to understand these core topics. And we're also updating the videos again. So that's more than enough. See, if you have read 27th edition, don't try to read the 28th edition. Just watch the update videos, which is something which you have, kept again. But if you have time, I think if you have time, certain chapters in which there is a lot of changes. For example, inflammatory bowel disease, transplant, pediatric surgery. It's better to read 20th edition, forget your 27th edition. Solving MCQs daily and revising, they definitely can overlap. MCQs, whatever it is, you'll have to solve 100 MCQs a day. Euro and transplant, you'll have to read from daily, as we mentioned before. Yes, video lectures sometimes contain points from other than the three standard textbooks as well. See, GI surgery, we do have very useful points from Shackelford and Lookat as well. Couple of points, not all, but there will be certain points. Thank you so much, guys. I'll be ending the session right now. You can put rest of your queries in the group. I'll definitely answer them for sure. If not immediately, within a few hours, I'll be answering them for sure. Hope this session was useful. Yes, the video lectures are different. The video lectures are comprehensive. For example, they are not just billion level videos. They are from Sanderson, Schwartz. They are a little more comprehensive than this thing. They are available on the search list. Thank you so much, guys. Bye.